Hi, I'm Chris with UAccess. We're here interviewing Dr. Brandon Mons. He's a sports medicine physician here at Emory, and he's also the Atlanta Dreams head consulting physician. Well, let's get upstairs and go start this interview. How did you become interested in sports medicine?
It's a good one I like to answer. I worked with patients when I was in medical school and residency who were really interested in being more active as far as exercising, and sometimes they would get injured and they weren't sure how to get back to their sports or their activities. So I like to educate, so it was a good way to teach them ways to get over their injuries and help motivate them so they could get back to the things they like to do.
And what was your path to sports medicine?
I went to undergraduate college for 4 years and then medical school for 4 years. And then after medical school, I did a residency in family practice medicine, which is a general primary care medical field. And after that, I went to a subspecialty fellowship training, which was I did it for 2 years. Programs are 1 or 2 years, and that was for sports medicine. And then it was at that point I was finished with my training and I went out in the world, so to speak, and started working.
Now, what courses would you recommend for a college student, and what undergraduate degree would you suggest them to have?
There's a lot of different ways to get there. Certainly the sciences are helpful, biologies and chemistries, and you have to have some math. And most colleges have prerequisites for those majors, but the key is really, when you're applying to medical school, what are the prerequisites? And so I know people who went through a business or psychology or the different natural sciences and just took prerequisites, and they actually liked their own specialty, their own undergraduate degrees, but then were able to go into medical school. So the key is, I think, though, honestly, is really hunkering down with the science classes and math classes, because that's a big part of medicine.
Now, I know you work with the WNBA and many other athletic programs, but what does your day-to-day clientele consist of?
I do work with lots of sports teams, and I do have day-to-day clientele and patients, and really every day it's really people you see walking down the street. You have moms and dads walking the dog after dinner. You have kids on different soccer teams. You have folks playing tennis on the weekend. So the spectrum is very wide, and those are folks who injure themselves. They're not sure what they need to do to get back to their sport, so they call my office, and we talk about the injury in the clinic and come up with a game plan to get them better so they can get back to whatever activity that they like to do.
Okay. Now, what is the most fulfilling part of your job?
I would have to say just really educating people, showing them what the problem is when they have injuries, and because a lot of times they come to my clinic and they're very downtrodden and upset about their injury, and when I can kind of help open their eyes and educate them on, well, here's what's wrong and here's what's not wrong, so don't worry about this, and then here's the game plan, and here's your treatment, so to speak, to get back to your sport. They get very excited, they perk up, light bulb goes on, and they're ready to hit it and leave and race out of the clinic to get back to their sport. So
get back to normal.
Exactly.
All right. Now, my generation has a tendency to base their career on financial success. Is there a way you can be extremely financially successful in this career?
In regards to being financially successful in this career, I think that's possible, but it really boils down to lots of things that really crosses all planes of life, where it has to do with hard work. You really have to work hard through college and medical school and residency, and the more time you put in, really working with people and studying and honing your craft, then you really start to kind of see the fruits of your labor. And medicine is very open to creativity. There's an art to it and there's a science to it. So people need braces for different joints and all types of things. So physicians are always inventing items that they can help their patients get better, and there's that kind of business part, if someone's interested in that can kind of help into the whole picture of what they deem to be financially successful. So
okay. All right. Now, is there any information you would like to give someone who's interested into getting into the sports medicine field?
Is there any information I'd like to give someone who's interested in getting into sports medicine field? It would be just really staying dedicated and trying to learn about what sports medicine is, and And it's kind of hard if you don't know where to start, but honestly the key is, I think, learning from people, shadowing, different physicians in clinics. Athletic trainers are the people who work with the teams, and they're more than happy to have students and people interested follow them around, see what they do. I would definitely talk to counselors who know people in the community who can help set those things up. Just really trying to keep your nose, in the books and learning the things that are going to apply to medicine in general, and then just having an open, sense of giving as far as volunteering and being out in the community and helping out.
Okay. All right. Well, I'd like to thank you for your time once again, Dr. Miles.
My pleasure.
All right. It's Chris, Dr. Brandon Miles, UAccess. Thanks for watching.